guys, happy hump day. It's Wednesday morning, 11:19, and this is your Dear John series for today. It's a very interesting case. It's a pretty significant and difficult to manage and control periodontal patient, my wonderful friend here that I've taken care of for years. He presented to me with severe peri-implantitis in the upper left. These implants I did not place, but they were placed in a nicely grafted sinus many years ago, and they suffered pretty significant bone loss until finally there was implant failure. So that's not what we're dealing with today. I will tell you though that implant infection did invade the sinus, and when the implants were removed, I did that in sinus repair and everything. The sinus was drained that day, and we did a bunch of saline irrigation, and it closed itself off finally. But the chronic sinus infection returned, and so Jim ended up having to have some sinus surgery not that long ago in order to try to treat that chronic sinusitis that was caused by the peri-implant infection. So that's something to learn if you didn't know that could happen. It's another reason why when we work in sinuses, we put patients on Augmentin. And so because of the different sinus bacteria that's present, and that's different from what's present orally. Anyway, today Jim presented to us on emergency. This is his last full mouth series. You can see the severe horizontal bone loss with some vertical defects and widening of the PDL, which is indicating that Jim has secondary occlusal trauma and bruxism. And so we're battling a lot. Bruxism and secondary occlusal trauma can light a match to periodontal disease and really speed it up. So the date on these x-rays is 10 of 24, and if you look at today's PA, here it is. This is perioendo involvement of tooth number 4. So the periodontal infection has reached the end of the root and surrounded the apex, and so the infection here we're looking at, I'm drawing with my fingernail on the screen there. The prognosis for this tooth is pretty much hopeless at this point. Some people will try to rescue this tooth and splint these teeth together, maybe take the Nd:YAG laser, which we are going to use this morning, and try to regenerate what has been lost. But really, knowing Jim's history, we've made an alternative plan. Periodontal disease, there's more than one way to skin a cat. Obviously, there are multiple treatment options that I can present to Jim, implants being one option. Knowing Jim's history of peri-implant infections, I wanted to bypass that treatment recommendation today and give Jim something that I think is going to be a little more predictable, knowing his history. And Jim is not a diabetic. However, he is on some blood pressure medications. He has a history of a lymphocytic cancer that's not active right now, but his genetics are coming into play here. And Jim also is a cigar smoker, and not anymore, right?
No.
Not anymore. History of smoking, which plays a significant role in periodontal disease. Anyway, Jim has a pretty significant case of gingival hyperplasia from a calcium channel blocker that he's been on for many years to try to manage hypertension. He is on a GLP-1 right now. He looks amazing. He's lost a lot of weight. They're weaning him off of his blood pressure medications, which I'm super happy about, because that is one thing that's making his periodontal disease difficult to manage. Anyway, today's treatment plan was going to be extraction with site preservation of tooth number 4. I don't think that it is a comprehensive treatment option for Jim. There's mobility and deep probing depths, heavy bleeding and suppuration in tooth number 3, 4, and 5, and 6 as well, with a severe recession defect on 6 because it's being traumatized in occlusion because of lack of posterior function on the left. On the left side, Jim has tooth number 12. It's also in a compromised position. There are no teeth distal to that since we had to take the implants out. And so today, my recommendation to Jim in our treatment discussion included extraction of 3, 4, and 5, and number 12. We're going to leave Jim in canine to canine. I'm going to clean out the infection, the peri-implant infection. I'm also going to take the Nd:YAG laser. This is the Millennium MVP laser. That's my best friend in this practice. And we do the LANAP procedure. We're LANAP trained surgeons in this practice, and I'm a believer in it. And you're talking to the biggest skeptic on this earth. Anyway, this works to treat periodontal disease, especially in compromised situations like stage 4 periodontal disease. I have no other option. I can't flap the patient open anymore. We're done with treatment options aside from non-surgical care. This little baby comes into play and helps us out tremendously. So we're going to extract 3, 4, 5, clean it out, graft the area, close it up, extract 12, do the same thing. Then we're gonna go back and do the Lannat protocol from 6 to 11 today. And I'm gonna get Jim ready for a transitional distal extension maxillary partial denture. And I'm gonna ask the restorative dentist to fabricate in something along the lines of Valplast so that we can restore posterior function for Jim, get him chewing, get him out of secondary occlusal trauma, get the fremitus out of the anterior dentition using that partial denture, and then continue to manage him and see if we can't control the periodontal disease in the maxillary anterior. I have had him under control in the past. He's difficult to control right now. However, I think this is a great option for him. The investment is low as far as the patient is concerned. The risk is low, and yeah, so that's what we're planning today. So thanks, Jim, and everybody have a happy Wednesday. We'll talk to you soon.